Welcome, everybody. We're just getting everybody into the waiting room. In from the waiting room, I should say, not into the waiting room. Great. Rachel, are we showing, is everybody in from the waiting room? Great, fantastic. So good morning, everyone, and thank you so much for joining today's call. Please note that today's convening is being recorded. Anything that is said or sent during the chat during this meeting may be a part of the public record. My name is Allie Franklin, and joining today with me is Kim Williams, and we are with Health Management Associates. Health Management Associates, or HMA, is a leading independent national research and consulting firm that focuses on improving the administration and delivery of public health, healthcare, and social service programs. And we are supporting the Mississippi Department of Mental Health in its efforts to enhance the state's crisis response system by providing monthly online crisis response trainings and monthly crisis partner convenings. I would love to welcome now DMH Director Bailey to officially kick us off.
Well, good morning, and thank you all for joining us for the first Crisis Partners convening. So many of you have already been participating in our in-person and then also our first virtual training and our second virtual training. And this is our first Crisis Partners convening. So we are so grateful for your time and your continued commitment to helping us strengthen our state's crisis response system. Your work across agencies and partners and organizations and communities is critical to ensuring that Mississippians in our state who are experiencing a crisis receive the right care at the right time from the right people. So this convening is a monthly, year-long opportunity for all of us to align efforts and share updates, and most importantly, to collaborate to advance the impact of our collective work throughout the state. I'm excited for the discussions ahead because we've had some great discussions and feedback from our trainings as well, and the chance to keep building on the progress that we've made together. So with that, I'm going to turn it over to the HMA team, and they can walk us through today's agenda, and we will get started.
Fantastic. Thank you so much, Director Bailey. And we're so excited because this is a follow-up to an in-person convening that we had back in April. So how we'll spend a little bit of time together is right now we've done a welcome. We're reviewing the agenda right now. We're going to do some housekeeping and introductions. We're going to talk through the structure and the purpose of the monthly convenings so you know kind of how we'll spend our time and what to expect. Then we want to share for those of you who were able to attend the April on-site crisis convening event, and for those of you who weren't able to attend, we want to do a short recap of the event, the themes, follow-up of the survey results, kind of where people where it resonated and where there were some thoughts around what other pieces are needed in the system as we move forward. And then we want to move into talking about referral and transitions of care. We're really excited that we're going to learn a little bit more around some great best practices that are happening right in Mississippi. And then we want to have a discussion around building some agreements together and what are the type of things that we need in order to help continue to advance the work that Mississippi is doing around crisis and cross-system collaboration. And then we want to make sure that you know what's on tap for future topics kind of month by month. And there's always time to have questions or to interact. This is really intended to be a conversation and an interaction. And so we want to share with you some ways to do that. So we want to move to the next slide. We'll talk a little bit around how. So for those of you who spend a lot of time on Zoom, this will feel like review. And for those of you who spend time on other platforms, this is just a quick introduction to where you'll see things. So if you take a look at the screen that you have right now, if you go to the very bottom of your screen, you'll see a little bar that shows on the far left, you'll see something that says audio, you'll see something that says video, you'll see participants, you'll see chat. If you were to click on chat, you will actually see that it opens up to the right another window that shows chat. And so it gives you an opportunity to be able to type into the message And as we shared, anything that you put in the messages, that's going to be part of the recording and is a part of kind of the public record. So just know that as we're doing this work together. So the ways to participate are that you can turn your audio, right? So you can be on mute or you can turn your audio on. You can have your video and, raise a hand. The other thing, you can chat, typing something in the message, like I'm doing right now. And when you hit the little, it looks like a little paper airplane, it sends it, and then it sends that chat out to everyone and you can see it. Another way that you can is if you see right next to on the bottom, you see something that says react. There you have the ability to raise your hand. That way we know somebody has a comment they'd like to make and we'll say, hey, come off of mute. We'd love to hear what you have to say. The one reminder is after you talk, make sure you lower your hand or else it always looks like you're raising your hand for a new comment. Another thing that you can do is in your reactions, you can actually say, yes, I agree with that, thumbs up, or you can do the hand clapping saying, yep, I agree with that. So that's another way. You don't have to hit it more than once. It will be up there for a few minutes and then it will actually disappear. And so those are called reactions. If you have questions or if you're struggling with any of those things, one of the things you can do is over on chat, where you can choose who to send something to. You can actually select just Rachel LaFlame. Rachel, if you want to raise your hand and wave for everyone, you can select Rachel LaFlame, and then she can try to help you on the back end around, I've got a question about how to unmute, or I'm not sure, it keeps doing a weird reaction and I don't know what to do, and Rachel can help you troubleshoot a little bit if that's helpful. Great. And we will not go over the how to use Zoom every single time. This is just our first time gathering together. So if you want to go to the next slide, Rachel. One of the things we want to do is get you using the chat. So what we'd love to do is have you please in the chat write your name, title, and organization that you're with, and then we'll do an icebreaker. But let's start with name, title, and organization first. So if you want to type that in, and then hit the little, like I said, paper airplane, or you can click enter to send. And great, I've got some people who are already using it. Great. Looks like a lot of people have found the chat. That's fantastic. I will use mine and give everyone a thumbs up and say thank you. Appreciate you finding that. All right. So if you have had the moment already to enter your name, title, and organization, now we'll ask that you move on to writing something in for the icebreaker. One thing that you're looking forward to doing this summer. Just write that in the chat. Let's see what kind of themes we've got. Not helping with son's homework. I like it. Yes. Suddenly, we all have to learn all the things that you forgot about in school when you're helping with homework. Hiking. Oh, not waking up early. Ooh, that sounds fantastic. Ooh, girls trip. Hopefully somewhere fun. Fantastic. Not having school activities, right? That's like a whole full-time job right there, full-time school activities. All right, fantastic. Well, thank you all for participating in that. And if you haven't had a chance to type in something around a fun summer activity, please feel free to do that too, because not only do you do incredible work to support your crisis system, but we all have to make sure that we take time to recharge our batteries too. And because you got to do the work for you so that you can keep doing the hard work for the system. All right, let's move to our next slide. This is where we wanted to talk around what are the components of the monthly convenings and what is the purpose and what can you expect. So each time that we get together, we want to share a couple of things. I will tell you this particular time, because we're doing a lot around sharing about the convening, about the structure of the convening, and the structure, and sharing feedback around our on-site event. We won't share national best practices on this particular call, but in the future, what you can expect is less talking about what we did on the on-site and more where we'll share some pieces around national best practices for the particular topic of the month, where we'll do a spotlight on Mississippi's best practices. And then we'll have an interactive piece where we want you to be involved in the discussion and have this be, really a multi-team member conversation. If we have a lot of folks, we can break up into breakout rooms whenever that makes sense. But there may be times like today where we're getting something started where we'll all be together in the same room and be kind of co-creating something together. The purpose is really around, and we got these themes, by the way, and you'll see this as we review what happened, the themes that came out of the on-site event. But really what we heard from you is that you want to build trust. You want to increase cross-system collaboration. We want to do our best to identify and remove barriers, all in the goal of continuing to strengthen the Mississippi Crisis Care Continuum. So we'll move to the next piece, which is we want to share with you, for our next slide, we want to share with you some themes that came out. So what was really exciting is we met together on site in April, spent a day together, and over 100 attendees came, and they came from all of the different sectors within the system. We had folks come to be able to share what's going on in Mississippi around peer support. We actually heard the voice of a person with lived experience in the crisis system to be able to talk about what his experiences were. We had representatives from all of the pieces of that crisis continuum, someone to talk to, someone to respond, someplace to go, someone to connect. And we had state leaders who were there both to participate and share. Had a really excellent presentation from Director Bailey around what was the roadmap, where have you come from, where are you at right now, and where are you all going from a vision for the future. But also had an opportunity for state leaders to come and to listen and to hear what are the themes. And so we really took the themes that we heard together and boiled them down into some key theme, kind of top line themes. And that's what we wanted to share with you today. So let's go to the next slide where we share a little bit around what we learned. So we had a great panel that was facilitated by Brent Hurley from the state. What we learned about that was working well in the system were pieces, and this was really around how does the system support a full crisis care continuum in Mississippi? And so what we learned is that there are some great pockets of excellence about where things are going well. No wrong door, education for for providers across the continuum, helping to build trust. That we heard about a best practice, Region 9's Crisis Connect meeting, a great place for shared accountability and partnership. Data. Really, these are pieces around a well-functioning system. And so would like a data dashboard that could track metrics, would like shared trainings across agencies and across the continuum. Some need more support for those who do the work to prevent burnout, deal with compassion fatigue. That's that piece around make sure that not only are you doing a great job of taking care of the crisis care continuum and of your agency and of the people who work together with you in this work, but also how do you make sure that you take care of yourself. One of the things, if you ever fly on an airplane, that they say, make sure that you put the oxygen mask on. If there's ever an emergency and you need an oxygen mask, put the oxygen mask on yourself first before you help someone else. That's important for us to remember, and something we talk about a lot, but don't always remember to do as humans who do this work. Really found and heard some ideas around would like to see CIT training be introduced at the police academy. That's actually going to be one of our topics over the course of the convenings. Kind of there a little bit of a debate came out about not what I loved. This was my favorite part about it, is that it wasn't should we have CIT training, but it was when should we have CIT training? Should it be at the police academy as a part of the training curriculum, or is it something else as a specific thing that would happen separate from that later? And so that was really a robust conversation. We want to move to the next slide. Then we had an opportunity to do a bit of a breakout session, and this was a different kind of a breakout session. Instead of it having a panel or speakers, we actually did a World Cafe where folks broke up and actually answered these 3 questions as a part of that breakout session, so that we really were able to hear from the members who came to the on-site convening. And our questions were, are there any unintended adversaries or components to the system that are getting in the way? Are there any missing elements to the current system? If so, what? What other agencies or service types should be at the table to strengthen the continuum? And what's been effective in the current system? Is there anything that hasn't been effective? So that's what we asked. And then we'll move to the next slide, and we'll share with you what we learned and what we heard. So unintended adversaries, or things that might get in the way. One of the things was challenges with collaboration or willingness to assist, challenge a lack of communication and education. There were some silos, gaps in the severe mental illness kind of space. What are the silos that are there? Helping, not enough education, also EHRs not connecting, and we learned about stigma. And so really what you'll hear from these themes is that these themes that we learned from you on the on-site actually helped inform both the trainings that are a part of the monthly trainings that are occurring and how we're approaching these convenings together. The goal is to really begin to close some of these gaps and to help make some of these connections, as well as to begin to develop the structures to say, what would it take to create more trust, to break down silos, to help address stigma, to think about some of those pieces. I'll move on to question 2 and 3 and the themes that came out of those 2 on our next slide. Question 2, any missing elements? Big list of missing elements. Who else should we invite to the table? We see a lot here around social determinants of health, around housing, transitional housing, transportation, but also feel like what are we offering in Mississippi around mental health services for people who have autism? Really looking to say, let's get more law enforcement folks to the table to be a part of the conversation. How do we think around cultural competency? Who needs to be a part of the conversation? Let's make sure we're involving schools in the conversation. CPS, how do we make sure we've got good funding around medication, staffing, training, and some of those pieces. Had lots of great ideas, brainstorms that came out around maybe social workers in every law enforcement department. So this was a really great brainstorming exercise around, who do we need to bring to the table and what kind of pieces could we be doing to help knit together this system and break down those silos. Let's go to the next slide, and that's our third question. Third question had some pieces to it. What's been effective? Being able to share, get the word out around 988 was seen as a strength. Peer support was mentioned quite a few times. Children's programs listed off MAP, SOC, MyPOC. Have more resources available than you did in the past. That was listed as a strength. Anything that's not been effective, disconnection. You're going to hear this silo theme kind of coming all the way through the day. Some questions around MCERT and response, short staff, so staffing issues, funding, burnout. Also, stigma sometimes getting in the way for where people didn't always feel comfortable accessing services, even when there were great services, because they were worried about being judged, or whether someone would know that they were getting care, or whether the care that they would get would be respectful and person-centered. Noted some gaps in crisis for folks who are experiencing intellectual and developmental disabilities. A need for broader education and some inconsistencies with MCERT teams was mentioned. I'm going to move us to the next slide. Then we did another panel, and the state's Courtney Littleton facilitated that panel. And what we learned there, some themes that came up. Again, you'll see this trust. I actually think trust shows up on every one of these slides that we're talking about. And so that's actually going to be a part of our conversation today, is how do we create a space together here and in Mississippi generally that's going to help build trust and collaboration and build those relationships together. A best practice was Heinz BH having an off-duty CIT officer on site 24/7. We know not every agency is able to do that, but that was one thing that was called out as something that was working really well. With youth resources, sometimes it's not about not having the resource, but people not knowing about it. And so if they don't know about it, then it's invisible to them. Transportation was listed as a barrier. That actually is a golden thread that goes through all of this, is transportation. And IDD systems need better training around how to meet people where they're at when they have co-occurring IDD and behavioral health issues. These are some key themes that came out of that panel. And then the next piece that we did, let's move to our next slide, was another World Cafe. And this was after identifying what some of those silos and barriers might be, what sort of things could be done to help break those barriers down, what trainings and technical assistance programs might be needed. I will tell you the answers from the trainings and technical assistance directly influenced the trainings that are being offered now as a piece of the all of the services that are being offered, and also how can Mississippi address regional differences across the state. And so that's thinking around cultural differences, but also urban versus rural, and how do you make sure that you're strengthening crisis care for all. And so the next slide really shares a little bit around recommendations. So collaborations. There was a great thing that I heard that was maybe doing education or CEUs cross-training. So if one agency is doing a training that they think would be useful to the whole system, do they open it up and invite other agencies or other staff from other agencies or other part of the system to come be a part of it? So not only do they also learn the same content, but they begin to get to know one another. It's hard to talk about us and them when we know each other and we have names and faces to go with different parts of the system. Sharing resources and boosting employee morale and incentives kind of on a system-wide basis. Let's go to the next slide. As you can see, it was a really busy, very packed day. What training and technical assistance, this is where we learned around, what about RAP? What about peer support? What about definition of the individualized definition of crisis? What about person-centered approaches to training or age-specific pieces? Standardized crisis training statewide for around crisis services. So great, really robust feedback received here. And our last question here. How can we address these differences? Shared data was one that came up. Data actually is a thread also that we saw. Peer review, statewide protocols, thinking around annual trainings, thinking around offering telehealth services or more workforce trainings for retention purposes. So really had a lot of different ideas around how do we make sure that there's a basic standard and a minimum around what is going to be happening in Mississippi, but then how do you tailor things to make sure that they're responsive to what is needed, in your particular community. Let's go to the next slide. All right, so and Kim, since you had a chance to talk to Lisa, would you like to do our quick introduction here?
Yeah, I would love to. So greetings, everybody. So delighted to be joining you all for this conversation. And I'm really thrilled to invite Lisa Burke from the ARC Mississippi to present and highlight best practice work that is happening there. So Lisa, feel free to I see you've come off mute and turned on your video, and I'll turn it over to you. And thanks so much for joining us today.
Thank you, Kim. Can you hear me okay?
Yes.
Great. I see on the screen this mission statement that talks about developmental disabilities. It's a good mission statement, but actually we've just revised that mission statement because though ARCs traditionally around the world do focus on developmental disabilities, Mississippi, maybe it's a little different, maybe it's not, but we've just modified that to say just people who experience disability and actively need supports in their life. And so we've gone down the road that Mississippi needs us to go down. We've been around a long time, more than 60 years. I feel like most folks on the call probably know who the ARC is. But in terms of crisis, it all sort of began when the SPOT team came together. We get a lot of phone calls from a lot of families and folks who just don't know what the next step is. And so many times the issue didn't fit the mold of an existing program or service, and we just weren't sure what to do. And we just began to talk. I tell folks, we don't have much money, but we like each other in Mississippi. And in fact, I met recently with a group of lawyers from Washington, D.C., who wanted to know about supported decision-making in our state. And when I explained how it worked, they said that wasn't possible, that we were doing it too friendly. We weren't using contracts and courts and formal funding streams and all these sorts of things. But they said, kudos to Mississippi for getting things done with relationships. And I think that's what's taken us a very long way. So a little more than 10 years ago, SPOT came into existence, and it was an experiment. If we don't know how to respond to folks with these very unique situations, then, many hands make work light. Let's put our heads together and let's see if we can figure it out. We may not have an answer right away, but we're not going to give up, and we're going to just keep at it. And I know several programs have actually come into existence as a result of what the SPOT team's been able to identify. But every other Monday at the ARC office in Jackson, you will find a group of people, either in person, on Zoom, or on the phone, that represent almost all of the state agencies, many of the providers, managed health care, Medicaid, just a group of decision makers who have come together in the spirit of caring and coordination. And we don't close cases. We don't give up. Some of those folks may have a solution at meeting number 1, and some of them may be still on the caseload 6 or 8 months from now. And we just keep going until we figure it out. But what has happened lately in that SPOT team is that we're seeing a trend of providers that are just becoming overwhelmed trying to manage crisis in the people that they support. And they just feel like maybe these folks could be better served somewhere else. Trouble is, there is no somewhere else in our state, and probably in every state. Funding is not arranged according to having lovely beds lined up and waiting for somebody to move into them. And so we are young as a state in terms of how many providers we have and how long we've had private providers. And we need to figure something else out. So what we thought was to try and develop the support that they were getting within those provider organizations to help them prepare for not necessarily if a crisis was going to happen, but when that crisis was going to happen. And we sat down and we involved the Department of Mental Health to try and help us understand how this could be best addressed. Once we got sort of a plan together, we showed it to the department, and they were very pleased and asked us to share it with everyone that we could. So we try to make this training very provider specific. We come to the provider. We try and get it done all in the course of one day. When you make it provider specific, people are more likely to share and open up with each other. We invite multiple levels of responsibility. We need buy-in from those leadership folks within that organization. We try and keep it small. 10 or 15 is good. We would rather come to you more than once to have a giant crowd of people. We ask them to identify their most challenging person to support. And it's interesting, I always laugh at how everybody will say the same name, at one time, because they're obviously are dealing with somebody right that moment that everybody is challenged by. And then after some initial training, we really spend a lot of time finding out who that person is, lots of notes, finding out who they are in their best environment and their worst environment. What traumas have they been through? What does history look like? We all know that the folks that we support are survivors. We try to figure out what is a trigger or what is a behavior. We all know a behavior is going to get you what you need, and a trigger is just a trigger. Once we've taken all that together and we write a description of who this person really is, it's interesting to see some of the staff have that aha moment. Oh, yeah, I never thought of them in those terms. And then we create a plan, and we involve everyone in that plan. We rehearse the plan. We invite them to practice the plan on a regular basis. We know who does what, who's responsible, who makes the call to the family, who calls the police or decides when it's time to call the police, who goes and is stationed in the woods if they're going to be a person who elopes and is running away to a specific place. Everyone is in the know. The plan is written down and is available and accessible to everybody at all times. And we understand that when that crisis takes place and we engage that plan, then you have to debrief afterwards. What did we learn? What needs to change about that plan? What did the person who is at the center of all this learn from our response? There are times when maybe what we've learned is you don't immediately chase them, and they sit there and they wait for somebody to come and chase them, and nobody chases them, and they wander back in and say, "How come you didn't chase me?" There's just a lot to learn through this living, dynamic, growing process. Turnover in staff means that we'll probably need to come to the locations multiple times. We have applied for CEUs through PLACE at the Department of Mental Health so that we can involve an entirely different level of support that may be missing right now. And we have been doing this since July. We are somewhere at least once a week. I am your designated third in line to talk to you about this, because the first two are actually somewhere in Mississippi right now offering this training at a provider's location. We've done almost 50 of these since July, and it gets busier and busier. And we're so proud of the response. The pre-post surveys have been amazing. We've had providers that have said, gosh, if we'd known what we know now, we would have just offered our services in a totally different way. So we don't pretend to know all the answers, but when you get everybody together who knows a person really well, and you come at it from the viewpoint of support and caring, and knowing that they are going to be yours. You're not going to pass them off to another location, another provider, another short-term facility, so that then the process has to start all over again. I think that we've made some really good strides. I think there are some folks on the Zoom that could maybe either challenge me on that or testify to that. But we've been so pleased with the responses and the outcome, and we continue to want to do this into the future. We can see where the need for this could outgrow IDD. CSUs may need this. Community mental health in the mental health field could use this. Perhaps, gosh, nursing homes, schools, there's a lot to learn about next steps, but we've been looking at who else could benefit from what we have to offer. You'll see at the bottom of that slide to contact Matt Knocker for more information. He is our executive director. He is one of those folks that are out there teaching today. And if you want to know more, if you want us to come see you, if you want us to come back and see you again, if you have questions, please reach right out. My email address is just as easy. It's lisa@arcms.org. And we'd love to hear what you have to say.
Thank you so much, Lisa. Appreciate you being here and for highlighting the best practices around SPOT and supported decision making. And, you know, some of the things that you noted and how you approach this work, I just think are so much in alignment with the themes that we've been discussing here, you know, around being proactive, around fostering, you know, collaboration and bringing people together, around ensuring that there's clarity of roles as part of the process, right? About being transparent and ensuring that everybody is really clear about what the plan is, you know, when someone is in crisis. And I'd actually be curious from folks on the call here, whether you've used these services before, you know, if you've engaged with the ARC of Mississippi, you can just comment in the chat. And also, obviously, we have a few minutes, I think, if you have any questions for Lisa.
And remember, you can raise your hand. You can put something in the chat.
Well, if there are no questions for Lisa, I want to again extend a thank you to you. All of you have, you know, Lisa's contact information, Matt's contact information, should you have any further questions or want to reach out and utilize this resource. I hope many of you do if you haven't already. All right. So now we are going to move on to the discussion portion of our time together. And as Ali, you know, noted in the beginning, what we want to do today is we really want to focus on your thoughts about what would support an effective cross-system collaboration. You've highlighted, obviously, in some of the challenges within the current system, that there is a need to work together more collaboratively, that there are opportunities to do so. We've highlighted just a couple of examples here based on sort of what we've heard from all of you around, you know, the possible need for agreements, possibility of interoperable systems. So we'd love to just hear from you, get your thoughts, get your feedback about what would support cross-system collaboration. And you can comment in the chat if you're comfortable. You can come off video, come off mute. We invite you now to share some of your thoughts and feedback. I will also just say, you know, as folks are thinking, right, you're like contemplating this question, right? I will say, you know, we didn't talk specifically about some national best practices here, but just to highlight a couple of things, just to get you thinking, you know, we've noted agreements, right? We've noted interoperable systems. Some things to be thinking about, right, are around sort of data, right? Quality improvement, shared metrics. So are there things that are needed, right, around agreements, around data sharing that would be helpful? Obviously around technology, right? Communication and technology can sometimes be helpful. That's come up quite a bit, right? The need for greater communication to support collaboration. So integrated systems, you know, being able to share real-time data with one another, coordinated platforms, and essentially also just thinking through what would be most helpful to reinforce crisis continuum integration, right? We talk about the continuum, someone to contact, someone to respond, safe place for help, right? How do you layer in and ensure that this system operates in harmony, right? With strong coordination, strong handoffs. So those are just some things to think about.
And as you can see, as we have this conversation, I'm taking some notes and we're just adding it in. You'll also learn that sometimes I don't always type perfectly, so I'll make sure to be correcting it as I go. So just thinking, building off of the feedback that we got from the one day that we shared with you, we heard a little bit around data dashboards, around coordinated platforms. Wanted to ask this group, first of all, there are other categories besides technology and agreements too. So what are other categories that we might want to add to the list? And again, you can put it in the chat or raise your hand or go off mute and just say something out loud too.
And I will also just add, there are no wrong answers here, right? It's like, if you don't have a perfectly formed thought, that's fine too. You can just acknowledge, say, this is a challenge, not sure exactly what's needed, but we can talk through it. Let's flip it and say too, do you agree that these are things like the technology, the agreements, does that make sense? Is that a path that, you all would want to take?
Got a quiet group this morning. That's okay. All right. Well, what if we take one? Let's start with technology because it's first on the list. What kind of things would you like to see, or what kind of pieces would make it easier for cross-system collaboration around technology? Or are there things that you've seen that are working really well in Mississippi that may be worth scaling? Do people have ways in which you're communicating around referrals that are working particularly well?
We've got a super quiet group this morning, but I know almost everyone that's on this call, and I know you have some thoughts on this specific topic because we've talked about them before. So feel free, really, this is a safe place to jump in and give us your feedback.
Kim, maybe one of the things we want to do just to create, building off Director Bailey, what you said around this as a safe space, is maybe we want to take a quick step backwards with the group and just develop a couple of, kind of norms for our group around, that this is a safe space, that as you can see, we're taking notes on themes and around ideas. We're not writing down this idea came from this person, or this thing, we're attributing, this person gave this particular feedback. Some other agreements that we've seen work really well with groups are, that we're going to consider all ideas, right? That we're not going to, we might question an idea and how that might work. Like as a group, you might question ideas around how something might work, but we're not going to attack people, right? That someone might say, help me understand where you're coming from, and do that in a respectful way, but not be saying that's a dumb idea. That's a good kind of rule of thumb. Kim, some other agreements that you've seen that have worked well with groups?
Yeah, some other kind of things that are helpful are just, right, that we're agreeing to engage, we're here to listen, like no judgment was essentially, what Allie was kind of noting. There sometimes it can be helpful in some instances, right, where certain members of a group might be real talkative and other members of a group aren't necessarily talkative, where you might, step up if you're one who's more quiet, step back if you're one who has a tendency to talk more. And then also just no distractions, right? Like making sure that we're in this space, we're engaged, we're present. I know sometimes that can be really hard to do. It can be also particularly challenging on Zoom. So those are just some things to be thinking about. that can be helpful when we're in a space like this and, engaging around conversation. So, and obviously if others have ideas, this is, this is your space. So certainly welcome you to also offer additional feedback of norms or community agreements that you've seen when you've been in spaces like this.
Open, consistent communication. Great. Thank you.
Yeah, thanks, Nicole, for that. Thanks for stepping out there, Nicole.
Yes, we appreciate
Yeah.
you. Other things that you might need in order to feel supported in this environment and in this kind of a forum together?
So everybody should now see a poll that would support effective cross-system collaboration. Welcome to respond to it. It's another way of, engaging you all.
Oh, and the poll is anonymous. Thank you, Rachel. Great. What I think might help us as we're moving forward, and so just learning on the fly as we're working together with this group, is we may end up doing a few more poll type questions for future gatherings together, just to make it maybe a little bit easier for people to engage.
I just want to acknowledge, I see a couple of folks, have responded to the poll. So thank you. Thanks for leaning in here.
Great. So we saw some messages around, face-to-face, around communication, some pieces around engagement. I had the results in order to get that screenshot, but then they have suddenly disappeared. Okay, great. Well, one of the things that we will do as a follow-up to this is we will share some themes that came from the poll that you took. As you can see, we're learning a little bit around how to use our polls in the best way possible. And I think what we've learned today is that we're going to use a few more polls in our convenings as we meet together with you the next time. Rachel, if you want to go to the next slide, what we want to share with you is our convening topics. And what's coming up over the course of the next year. So in July, we're going to talk about workforce recruitment and retention. And we share this with you, one, so you can think about who's not at the table, who you'd like to bring to the table, but also who at your agency might be the right person to bring to be a part of that conversation. And know that, we're going to, again, our structure is we're going to share best practices. We're going to have a spotlight on something great that's happening in Mississippi. And then we'll have an interactive discussion of some kind around how we can think through, advancing this work in Mississippi. And so in August, it's around non-emergent transportation. September is technology, data sharing agreements. In October, we're going to explore the role of peers. November, language, cultural humility, and accessibility. December, building sustainability from financial support, thinking about federal and state dollars, also frankly, local dollars. January is around social determinants of health and the role of community partners. February, getting specific about youth. March, thinking about special populations, so IDD, veterans, etc. April, we're going to talk about tracking future outcomes and quality. And in May, we're going to talk about future and emerging trends that are happening, again, nationally and statewide. And the next piece that you'll see is that you will receive a survey at the end of this convening today, where we'd love to get your feedback and ideas around, how can we make it, knowing that we're trying to do it virtually, how can we make this more interactive? How can we help it feel like something that folks feel like they can engage with, so that it does meet the goal of building better collaboration across your continuum of care and across the system. And it may be that, again, we do some more breakout groups or we do some polls. We are really excited to hear your feedback and to collaborate together with you so that we can all work together to advance where Mississippi is going in this space together. So our next slide, I think, will kind of share with you a little bit around, please help spread the word around getting other crisis continuum folks to the table. And again, just really wanting to have this be a really robust, interactive conversation together, so that we can continue to advance this work. And thank you so much, DMH, for your support of pulling this group together and for being responsive to everything you heard from the on-site. And thank you, everyone, for being here. And thank you, Lisa, for sharing all the great things that are going on with ARC. We hope you all have a wonderful day. Thank you.
Thank you all.